Hi, hello, welcome to my channel Budding Dentist. Today we are going to discuss about maxillary sinus. Before getting to the topic, we will see the basic features of paranasal sinuses. What is sinus? Sinus or the air-filled spaces. Paranasal sinus or the air-filled spaces which is present within some bones, that is around the nasal cavity. At birth, it is absent or rudimentary. Rudimentary is nothing but it is underdeveloped. At the age of 6 to 7 years, it enlarges, that is at the time of permanent tooth eruption. There are 4 paranasal sinuses, that is the frontal sinus, sphenoidal sinus, ethmoidal sinus and the maxillary sinus. Maxillary sinus present in the body of the maxilla and the sphenoidal sinus present in the body of the sphenoid bone. The frontal sinus present in the frontal bone which lies close to the superciliary arch, and the ethmoidal sinus present in the ethmoid bone, that is within the labyrinth of the ethmoidal bone. Maxillary sinus, it is the largest of all paranasal sinuses. It is also known as maxillary antrum or antrum of Highmore. Okay. Maxillary sinus. Maxillary sinus, it is a pneumatic space that is lodged inside the body of the maxilla. It is the pneumatic space that is launched in the body of the maxilla. It communicates via middle nasal meatus and the nasal vestibule. It communicates with the exterior with middle nasal meatus and the nasal vestibule. Okay. Maxillary sinus, it is pyramidal in shape and the size is variable. The average measurement is height is 3.5 cm and the width is 2.5 cm. The antero-posterior depth is 3.5 cm. Let us see the boundaries of the maxillary sinus. It has 4 surfaces, that is the 4 walls: anterior wall, posterior wall, inferior surface and the superior surface. We'll see the base. The base is medially towards the nasal cavity, the medial wall. Okay, it is medially towards the nasal cavity, and the apex is laterally towards the body of the zygomatic bone. It is the apex. It is laterally towards the body of the zygomatic bone. This is the zygomatic bone. Okay. Anterior surface. It is the facial surface of the maxilla. And posterior surface, posterior wall, it is to the infratemporal surface. And superior surface, it is to the orbital surface, and inferior, it is to the alveolar and the zygomatic process. It is to the alveolar and the zygomatic process. Let us see the microscopic features of the maxillary sinus. This layer it is the epithelial layer. It is the basal cells of the epithelium. It is the connective tissue part. In the connective tissue, it contains minor salivary gland. Okay, the epithelium is lined by pseudostratified ciliated columnar epithelium. The epithelium has cilia and it has goblet cells. Okay. What is goblet cells? The goblet cells are goblet in shape. Okay. It is with a basally placed nucleus and the apically placed cytoplasm. Okay. It has the basally placed nucleus. You can see here it is the nucleus and apically placed cytoplasm. Okay. In H and E section, it appears the cytoplasm appears empty. Okay. Cilia, the function of cilia of the lining epithelium, it helps to move the secretion. Where the secretion is found, it is filled in the cytoplasm, the apical cytoplasm filled with secretory products. So the cilia helps to move the secretion. Okay. And in the connective tissue part, it has mixed salivary gland. Let us see the blood supply, arteries, veins and nerve supply and the lymph nodal drainage we will see. Okay. Arterial supply. Maxillary sinus is supplied by facial artery, infraorbital artery and the greater palatine arteries. Venous supply. It is supplied by facial vein and pterygoid plexus of Peyns. Nerve supply. It is supplied by posterior-superior alveolar branches from the maxillary nerves and the anterior and middle superior alveolar branches from the infraorbital nerves. That is the maxillary nerves and the infraorbital nerves. Lymphatic drainage is via submandibular lymph nodes. Okay. What is the function of the maxillary sinus? The main function of maxillary sinus is the humidification of the inspired air or conditioning of the inspired air. The other function is to make the skull lighter by reducing the weight of the facial skeleton. Okay. It also increases the craniofacial resistance to the trauma. Phonetic resonance. These also add resonance to the voice. In case of infection of the maxillary sinus, there is an alteration in the voice. Okay. It increases the area of olfaction. It has bactericidal property by production of lysozymes. Insulation. It has another property called insulation. It insulates the orbit from various intranasal temperatures. Okay. Growth and development. When the maxillary sinus enlarges, the facial skeletal also enlarges. Okay. It also develops. Filtration. Filtration of an inspired air. The main function of maxillary sinus is humidification and filtration of inspired air, and it also adds resonance to the voice, and the another important function is it makes the skull lighter. Okay. Clinical consideration of maxillary sinus. When there is an infection, that is the sinusitis. Okay. Sinusitis means there is an inflammation of the mucosal lining in the sinus. Okay. When the sinusitis occur, there will be an headache or the discharge from the nose. Okay. If the infection occurs via nose or due to tooth caries, drainage should be done. The drainage is done by two artificial methods, that is the antrum puncture and Cadwell look operation. In antrum puncture, what is done is what we will do is we will break the lateral wall of inferior meatus so that the liquid is drained via the lateral wall of inferior meatus. Okay. And in Cadwell look operation, an opening is made at the canine fossa and the drainage will happen. Okay. And another condition is oroantral fistula. It occurs due to traumatic extraction of maxillary first and second molars. Okay. It is diagnosed by radiography and transillumination. Radiography in the sense IOPA and OPGs also helps in diagnosing oral antral fistula and the sinusitis. Carcinoma of the maxillary sinus arises from the mucosal lining. If the carcinoma it is in the orbit, it causes proptosis and diplopia. Proptosis is nothing but displacement of eye, and diplopia is the double vision. And in the floor, it causes bulging and ulceration of the palate. In the forward growth, if it obliterates in the canine fossa, it causes swelling of face. Okay. In the backward growth, it may involve the palatine nerves and the pain referred to the upper teeth. If the carcinoma grows in the medial direction, there will be nasal obstruction, epistaxis and epiphora. What do you mean by epistaxis? It is nothing but bleeding from the nose, and epiphora is excessive watering of eye. Okay. If the growth is in the lateral direction, if the carcinoma growth is in the lateral direction, it causes swelling of face. Overall, if the carcinoma of maxillary sinus happens, it mostly causes swelling of the face, ulceration of the palate, and the pain in the upper tooth. Okay. So we have to consider these things while handling patients. Okay. My references are Human Anatomy, BD Chaurasia and Maggi Juice. If you have any doubts regarding this maxillary sinus or any lectures what I have uploaded previously, you can ping me in the Instagram. Okay. Thanks for your patience. I will be active more in the Instagram. You can ping me. I will reply you regularly. Okay. If you want any career related advices, you can check the video career options after BDS. Okay. Thank you. Thanks for your patience.